Hi friends, this is Dr. Muthukumar from AL Aragya Spine and Bone Care Center. Today we're going to talk about cauda equina syndrome. The spinal nerves, especially in the lumbar region, when the spinal nerves is completely compressed, the condition is called cauda equina syndrome. The lumbar nerves supply to your lower extremities, bladder, genitals and anus. Now we're going to see the major causes for the cauda equina syndrome. The first one is trauma. The second one is spinal abscess. Third one is spinal fracture, spinal inflammation, spinal infection, sometimes RTA, road traffic accident, sometimes malignancy. These are the main cause for the cauda equina syndrome. The next one is we're going to see what are the major symptoms for cauda equina syndrome. The first symptom is, we'll explain one by one. The first one is regarding the bladder symptoms. The first symptoms is loss of sensation while you are passing urine. The second symptoms is the urination is changed from normal to different. The next one is loss of feeling completely bladder empty, loss of sensation of fullness of bladder. These are the common symptoms in the urinary bladder. The next one is colon. Sometimes you don't feel like a completely evacuation, a loss of feeling of bowel movement, sometimes constipation in the bladder, sometimes inability to stop or control urination. The same thing happen in the bowel also. You cannot control the bowel movement. Sometimes when you go outside, that you will feel urge to pass urine, urge to pass motion. These are all the basic symptoms of cauda equina syndrome. The next one is musculoskeletal nervous system. Sometimes you feel no sensation in the lower extremities, sometimes really weakness, sometimes you feel numbness on the both lower limbs, numbness in the anus system, sometimes numbness in the genitals, especially for male and female. When you having intercourse, you don't get sensation to have intercourse, inability to ejaculate or erection. Sometimes you feel numbness around the scrotum or penis. For female, loss of sensation in the clitoral region. And the next one is, I told before, the musculoskeletal system, the absence of DTR, deep tendon reflex, in the lower extremities, loss of sensation in the lower extremities, loss of deep tendon reflex, which is called DTR. After that, loss of ability to move the legs. How to find out this condition? If any of you one is having these kind of symptoms, so you have to go for the proper MRI or CT or myelogram to find out exactly what's the problem. If it is cauda equina syndrome, so you have to go for the proper doctor, consult, and then make sure follow the doctor instruction and go for diagnostic procedures in case MRI or CT or myelogram, and find out the proper reason and go for proper way to rectify that. After delivery of C-section, female used to have this kind of symptoms. Maybe due to that abdominal pressure also, this bladder and bowel disturbance will happen. Same thing will happen in the cauda equina syndrome also. So you have to go for the proper treatment, proper exercise to balance the bladder condition and same times balance the bowel condition. So you have to follow the proper diet. Guys, now you know what is cauda equina syndrome and symptoms and causes, why it's coming. So everything I explained to you. So hope you will understand. And then if any of your friends having this kind of symptoms, please share this video, let them get the benefit, and then I will see you in the next video with a different topic. Thank you so much.